Denise Fleck with Sunny Dog Inc., helping you to help your pets. Let's talk about checking your dog or cat's vitals. Just like us humans, it's important to know how to check breathing, respiration, temperature, and other things on our animals to know their general health. As far as breathing or respiration goes, it's pretty noticeable in the same fashion on our dogs and cats. The best place, however, to notice it is on the chest. Look for that rise and fall, or just place your hand here to feel them breathe and exhale. For the most part, our medium to large dogs breathe 10 to 30 breaths per minute, and our smaller friends about 20 to 40 breaths per minute. The easiest way to remember it is that the bigger and older the animal, the slower he's breathing and the slower his heart rate. The smaller and younger animals breathe faster and their heartbeat is faster. Next, we want to be concerned about pulse. The best place on our dogs and cats is the femoral artery. Think of the big femur bone in the leg, place your hands at the knee, and roll your fingers to the inner upper thigh. That's where you're going to feel for the pulse. You can do it on either hind leg, but this is a large, meaty part of the animal that contains a lot of blood, and it should be quite easy for you to feel the pulse here. For our medium to large dogs, it's going to be around 60 to 160 beats per minute. For our small cats and dogs, it could be as high as 200 beats per minute. So you want to get familiar with that ahead of time before you need to know these particular vitals so that you know what they feel like. The third vital I'd like to talk about is temperature. And you want to go to your pet first aid kit and get out a digital thermometer. We don't put a thermometer in the sharp end of our pet for obvious reasons. They chomp down on it. We're going to have to take their temperature under the tail. There's a little silver sensor here. That's where we get the temperature from, not down here, meaning ½ an inch to an inch is more than sufficient. Hold on to it while you place it in your pet, pulling his tail back so that he doesn't sit down, and you will get that reading hopefully in the neighborhood of 101 degrees Fahrenheit. The next one is capillary refill time. In medical terms, it's called CRT, and it's probably something you've been doing since you were a child. Have you ever pressed on your nail bed, turned it white, and then released that pressure to see how quickly the pink color comes back? This can be really important to a pet who has lost a lot of blood, who hasn't been circulating blood, or has certain illnesses. It helps us determine if the animal has gone into shock. But pressing on our dogs or cats' nail beds doesn't really do us a lot of good. So we need to carefully come over here to the mouth, lift the lip, and what we actually do is press on the gum above the teeth until we whiten or lighten the area. We then release that pressure and hope to see the color come back in 2 seconds or less. Last but not least is checking hydration, or the lack thereof, dehydration in our pets. And we generally just grab a fold of skin here at the nape of the neck, and when we release it, if it falls back in place quickly, we feel we have a well-hydrated pet. Truly a better test of hydration is to once again carefully come to the mouth and feel the gums. If they're sloppy wet, your pet is good to go. He's well hydrated. But if the gums are dry or even sticky, encourage him to drink. So know your pet's vitals, and add one more thing to that: know their weight, because a lot of things you may need to do need to be dosed according to their body weight. If you have a 95-pound lab written down as 100, you're not that far off. But if you have a 3-pound Chihuahua written down as 5 pounds, that's almost double her weight, and any dosing of medications you would do, you would overdose her on. So make sure you always know what your pet's weight is so you can give them the proper help when they need it.